Hello everyone, welcome to our educational channel. My name is Zetu. Today I would like us to talk about placenta previa. Firstly, what is placenta? Placenta is a temporary organ that connects the growing baby to the mother's uterus during pregnancy. Placenta supplies oxygen and nutrients to the growing baby through the umbilical cord. Placenta attaches in the wall of the uterus, usually on top or at the side. What happens in placenta previa? Or what is placenta previa? Placenta previa, the placenta is attached on the lower segment of the uterus, or it is attached close to the cervical opening. The cervical opening is the one that is going to dilate during pregnancy, but it becomes a problem if the placenta is attached there. There are types of placenta previa. We've got marginal placenta previa. In marginal placenta previa, the placenta is at the edge of the cervical opening, but is not closing the opening. We've got partial placenta previa. In partial placenta previa, the placenta is covering half or is covering partially the cervical os, and we've got complete placenta previa. In complete placenta previa, the placenta is covering the cervical os completely. Therefore, there is a problem there. It will not be easy for that mother to deliver normally, or it may deliver normally, but there will be a lot of complications. Therefore, the pregnancy becomes risky. What are the causes, or what are the risk factors that can lead to this pregnancy complication, which is placenta previa? One, if the mother is falling pregnant and is above the age of 35 or more, therefore we're talking of advanced maternal age, it becomes a problem. There is a possibility that mother may develop a placenta previa. Another risk factor, if the mother is pregnant and carrying more than one baby, it can be twins or it can be triplets. Another complication or another risk factor, if the mother had previous surgery and he fall pregnant, he had some surgery that has been done. An example of that, it can be a previous cesarean section, or the mother had the operation in the uterus like myomectomy. Another risk factor, if the mother is smoking or is taking drugs like cocaine. There are quite risk factors that can contribute to this complication of placenta previa. What are the signs and symptoms of placenta previa? When the mother is pregnant, is not supposed to bleed. You'll find that there will be episodes of painless bleeding. And in that case, on routine examination of the mother, you will discover that the placenta is lying on the lower segment. And this condition is usually discovered after 20 weeks or more, when we discover through the ultrasound or through the other test, the doctors will discover that the placenta is lying on the lower part of the uterus. What is the treatment of placenta previa? The mother will be still pregnant, therefore that mother needs close monitoring for that pregnancy. Firstly, routine antenatal visits. It must be more frequent so that the mother will be checked every now and then. The mother needs to be educated about her condition, and the mother herself need to monitor and report any bleeding, because the main symptom here, it will be bleeding. And bleeding, it can start from mild and maybe it can be profuse. Therefore, the mother must know about her condition. Any bleeding that she's noticing or any discomfort like contraction that she's feeling, you must immediately inform the doctor, or you must immediately go to the hospital. This pregnancy is risky, therefore bed rest is encouraged, and the mother needs to be educated to avoid any strenuous exercising that can lead to bleeding. It is important for the mother to know exactly what is the problem, because if the mother knows what is the problem, the mother will be able to cooperate and communicate immediately with the health providers or with the doctor's consent. And another thing is the mental preparation or psychological preparation of the mother. The mother needs to be informed that in this type, depending what type, or especially if it's a complete placenta previa, that baby cannot be delivered normally, and the mother needs to be prepared and educated that during labor, the method of choice for her to deliver the baby safely will be a cesarean section. All that will help the mother to prepare herself and make sure that she takes enough rest, and make sure that she reports any slight complication that she is facing during pregnancy, so that towards the end she will have a safe delivery. And what is important here, we want the mother to be safe, and we want the baby to be safe. What are the effects of placenta previa to the baby? Usually, the baby, they are delivered prematurely, because if sometimes the bleeding is so severe, and even if the mother is not yet at full term, maybe the doctor will recommend cesarean section so as to save the baby as well as to save the mother. The main problem in placenta previa is the bleeding. Premature babies are also having their own complications. Therefore, if the baby is delivered premature, that baby may need to be admitted in neonatal care unit. Another effect of placenta previa on the baby, you'll find that the baby, they are born like small intrauterine growth retardation because of the poor placenta supplies. There are quite a few complications that can happen to the baby, and those complications that can happen to the baby, but if they are monitored, they can be sorted after the pregnancy. Towards the mother needs to know that cesarean section will be a method of choice for her to deliver. And psychological preparation it's important from the health provider, so that we are having healthy baby and the healthy mother. Although placenta previa can happen, but it needs to be monitored, and we will still end up with a healthy mother and the healthy baby. For today, we will end up here. Thank you for watching. Till next time, stay safe and stay